Hello everyone. So before you start watching this video, please don't mind my voice and the inappropriate breathing spells that I took in between because I'm suffering from severe cold and cough right now. Hello everyone. So our last video was about the approach to final year and the next step that comes is planning. So today we are going to discuss a timetable that we followed and it worked for us for real in our final year. So before we go into the details of timetable, it is important for you guys to identify your weak points. The weak points can be the subjects that you don't like, and they can also be the subjects that are difficult for you to understand and comprehend. So identify these and then start planning. Also, please remember that it is okay to not follow your plan in your final year. It's okay to not stick with it for the most part of your final year, but trust me, this is going to help you maintain your sanity and mental peace in the times when you feel really low or in those times when you start doubting yourself and you want to give up. It comes handy then. So let's start with the timetable. Coming to the subjects, there are two subjects that demand your attention throughout the final year. That means you have to study them every single day or at least once or twice in a week throughout the year to learn the concepts and also to remember them. And those are orthopedics and gynecology. Both are volatile and voluminous and I felt a little boring. They may not be the same for everyone, but it's good to read them at least once or twice in a week, and it's better to revise them before you start a new topic. This way you will improve your memory power in these topics and it will help you a lot in your final exam. Now coming to obstetrics. Obstetrics is the easiest topic in final year. Obstetrics is logical, it is factual, it is interesting, so you will remember it easily. You don't need to by heart anything except for a few definitions. So I would suggest you to start off with obstetrics and it will take around 7 to 10 days to complete all the essays. So first do that, finish the essays and keep the book aside. And coming to the small topics in obstetrics, which are really important for your marks, they fetch most of your marks. You can do them when you're burdened or bored with the huge subjects like surgery and medicine. But essays are must, they should be finished in a go, in a week or 10 days time. Now, we'll go to surgery. In surgery, you are starting with GIT because GIT, if done, your surgery is done. So, when you're doing GIT, you're going to combine your surgery GIT with medicine and pediatric GIT also at a time. And this will take about 2 months whole to finish the entire GIT. And remember, we are doing orthopedics and gynecology during this time also. I advise you to make notes for GIT surgery because it is so huge in SRB that it's impossible to revise it in a night before the exam for your paper 2. So take this 2 months properly, finish the entire GIT, finish the medicine GIT and then pediatric GIT. Once this is done, move on to pediatrics. In pediatrics, finish the first 11 chapters which are specific to pediatrics. Others can go hand in hand with medicine. So start with pediatrics, finish all these chapters, make notes if possible if you feel like it's needed, and then keep revising the GIT and do the gynecology and orthopedics. All this thing will take 3 months. And by this time, it's almost the internal time in most of the colleges. So if your internal dates are known, it is better to stop whatever you're doing and then start preparing at least a bit for your internals. For example, we had general surgery for our internals. So I stopped reading GIT and pediatrics about 15 days before the internals and then started reading general surgery. Trust me, for finishing all the essays before an exam, it will take around 5 to 6 days. You can finish all the essays of general surgery. Also, I tried to finish 2 out of 4 topics that were there for the internals from medicine. Obstetrics was almost done because the essays were done. Gyne and Peds was not really important for internals and pre-finals for me, so I didn't really pay attention to them. The most successful part of the internal preparation was 2 chapters of medicine and the general surgery, most part of general surgery. And once your internals are done and then you are done with relaxing, it is time to finish the medicine and pediatric part of hematology and infections. They are huge and they take time. So please do medicine and pediatric infections and hematology immediately after your internals. Though there may be fest or there may be some celebrations, some occasions, most of the colleges celebrate their fest during that time, but it's important to finish these 2 things. You can do like 2 infections per day, 1 hematological abnormality per day. You don't need to like finish it in a rush. You can do it slowly, but try to do the important ones at least. Important in the sense, the ones that are really relevant and clinical, like dengue, malaria, and then leukemias. Then with this, you're left with a major part of genitourinary system from surgery, and this will take about 15 days if you study for about 6 to 7 hours per day along with making notes. I made notes for genitourinary tract, I made notes for GIT. I didn't really make notes for general surgery. I had notes only for shock because I felt 1 notes of shock will cover your hemorrhages, burns and shock. So I used to combine things that are similar and then make notes together so that revising will be easier. This way you are done with almost all your portion, but remember, still we haven't touched medicine as a whole, as a topic, because there are so many systems that need to be touched which are really important, like CVS, CNS, RESP, etc. Now, based on the time, if it is already October, then start revising for 60% of your day and use 40% to do 1 system at a time from medicine. And you're doing gynecology and orthopedics every single day. You're done with GIT, you're done with obs essays, and you'll be doing the short questions from obs now and then. So you're fine till now. Medicine systems and pediatric systems go hand in hand. You're revising, you're doing systems slowly. And by the time it's October, it is very important for you guys to start revising. Please remember, because the pre-finals are in December and finals are in January in most parts of South India. Coming to North India, you guys can shift your plan little bit ahead, like 10 to 15 days, because your exams are sooner. And about practicals, do not worry at all about practicals until your theory exams are done, because you have enough time for your practicals. Finish your previous 10-year papers before your pre-final exams. In the final year, before final exams, you're already way too much stressed and you don't really find time to do these question papers. And doing them before pre-finals gives you an insight about how your exam is going to be. And as we all know, since the first year, the 10-year papers are very important, and almost all the time the important questions are repeated, and it is the same even in final year. One more thing, in the initial days, if you find time, like for example, now we are in quarantine and you don't have college, you don't have clinicals, etc. So you can utilize this time to go through Davidson, like start flipping through the pages so that you'll get accustomed to the text and the way he's trying to teach us medicine. This will help you in reading Davidson later on. Also, if you feel burdened by the Davidson, do not hesitate to switch to Mantappa and read for your exam, because passing your exam is really important. Concepts can follow, but you need to clear your exams in a go in final year, because it is really important. The take-home message for today is, if you do your obstetrics and GIT part of surgery, you will be done with most of the part of your final year, and you can do the remaining things happily without any tension, because they follow on their own. Depending on your situation, you can make few changes and you can make your own plan and then keep doing it. But if you're done with these two, you'll be fine. After pre-finals, theory and your practical exams, you'll roughly have 20 to 25 days in your hands. Even in this time, you can utilize the initial 4 or 5 days to read the new topics that are completely new, which are a potential source of questions in your exams. If you have left out anything before, if you have left out anything in the pre-finals, please do read them at least once. And then you can start revising whatever you feel is important according to you. But if your first exam is medicine, revise medicine at the end. Don't do it twice in those 20 days because you'll not have time. Also, final year exams are a replica of your second year exams. So please remember how difficult it was for you guys to attempt paper 2 of pathology, paper 2 of microbiology and paper 2 of pharmacology. Your final year is going to be the same. So please keep reading from the beginning. Try to finish at least the important questions and then you can do the rest slowly. If you like the content, please subscribe, share it with your friends and support us. Thank you.